stay minimally invasive always. Check your lamp, check the intensity of your lamp, and as much as we care about the smile of our patients, we also need to take care of the smile of ourselves. I'm Danijela Marovic. I come from University of Zagreb School of Dental Medicine. I'm the Vice Dean for Finance, Infrastructure and Projects.
Okay, and what do you think about Dental World? Do you enjoy the event and its atmosphere?
It's amazing. This is a huge event. I like it so much. So many good lectures, amazing lectures, so many exhibitions, a lot of people. I'm truly impressed.
What key criteria help you decide between using a single shade or layering technique in anterior restorations?
I usually pay attention to the individual needs of the patient. So if the patient has a halo effect, then of course monochromatic shade is not good enough for the younger patients. But for the older patients, we can do even class 4 restorations with monochromatic technique. Diastema closure, and a lot of indications are for the monochromatic technique. But of course, for some complex cases, we would use the polychromatic technique, which is, of course, always gives the best aesthetic results.
How do advancements in optical properties of composite resins enhance the blending effect in monochromatic restorations?
Monochromatic composites are a big deal right now. So this is a big shift from polychromatic technique. It simplifies the procedure, and it's mostly to do with the reduction in the filler content and also the improvement in the refractive index, matching of the fillers and the resin. So this is what mostly makes the difference. And the newest composites, of course, they have the translucency shifting from very translucent to opaque in as short as 3 seconds. So this is the biggest advancement.
What strategies do you recommend for clinicians to improve efficiency without compromising aesthetic results in complex anterior cases?
The improvement of efficiency is mostly related to the use of monochromatic composites. So monochromatic can be truly used in a lot of cases, and this saves time. Because in polychromatic technique you have impurities, air bubbles between layers. Monochromatic technique can be exceptionally good in some cases where you don't have the adjacent tooth, which has high translucency, halo effect. This is what can truly improve the efficiency in the clinical office.
What is one take-home message of your lecture?
Take-home message of my lecture is, despite that I talked about the restorations and the composite materials, my take-home message is stay minimally invasive always. Check your lamp, check the intensity of your lamp, and as much as we care about the smile of our patients, we also need to take care of the smile of ourselves. So we need to take care of us as dentists as well. Simplify the procedure as much as you can to have the best option for you and your patient. Dental World Conference is one of the greatest conferences that happen in the Southeast Europe. So definitely come. Don't miss it next time.